So we're live. Um, we have a different kind of guest from the usual, I think. Um, we have Molly. I asked Molly to, in first instance, I asked her to tell her story. Uh, that wasn't that spectacular, she said. So then we started talking about different things, and maybe we can come up with something good that people can listen to. So, Molly, welcome.
Thank you, Peter.
Um, just for people who don't know you, can you do a brief introduction?
Sure. I am a nurse. I work in women's health. Um, my nursing background is somewhat diverse, but I've landed in women's health after several years. And I am an atheist. And I don't actually think I've ever said that in public before. um, as you mentioned, my background in terms of religion is not all that dramatic. I was raised Catholic, and I fell out of that fairly efficiently. Um, but for a long time, I just identified as agnostic and didn't really consider it too deeply. I live in a very conservative part of the country. Um, so it's not necessarily a position you can hold publicly without a fair amount of flack around here.
Hmm. That's where you live. That's still an issue.
Yeah, and it's not necessarily like the more dramatic scenes involving, atheism and theism. Um, but it's certainly going to get you some strange looks and some judgment around here. Um, it's like I said, it's a very conservative, um, a very Christian area.
What would you say makes people look at atheists that way? What's behind it? Does that come from? Because uh, people who don't believe in God aren't that much different, I think, from other people.
Well, I mean, I think what we've all kind of experienced one time or another is that there's a misconception that atheism itself is a dirty word, and they don't understand it, even though it's fairly simple. Um, and they tend to, and again, I'm sure we've all heard this, that they don't understand where we glean our morality from. If we don't have an incentive to be good people, then why be good people?
Yeah,
So I
but
think that the misunderstanding creates a certain amount of fear.
do you think that churches have a hand in this as well by putting up the wrong image of the non-believer?
Oh, of course, yeah. Um, I think churches do that with a lot of different things. Any group that doesn't align directly with their ideology is demonized. So it's not just us; it's everybody. um, but yeah, certainly, I do think that churches go out of their way to make it seem as though we're not people that you want to interact with. That we're somehow depraved people.
Yeah. Well, um, it, in Holland, it's completely different. Here, it's more unusual if you meet someone who's uh, who's active in a church. So
Sure.
it's completely the opposite. And yeah, just this week there was a publication about Dutch kids being the happiest ones I don't know if you saw that one.
I did.
Someone tweeted it to me. Um, I don't know if that's a fact, but it seems that we have a different way even to raise our children. So I don't have a clue, but yeah, as I said, religion doesn't have uh, any foothold uh, around here. But you being in a medical profession,
Mhm.
um, I assume you bump into a lot of things related
Yes.
to religion, and not the good things necessarily.
Not always, no. And there's a certain perception as a caregiver that you have to have, religious faith in order to do that effectively around here, given that we're in the minority. So it's not something I commonly share, because I don't want it to affect the perception of how I do my job. And yeah, certainly there's routine questions that I need to ask people on a daily basis that pertain not to, you know, that have to do with personal preferences in their healthcare, and it doesn't have anything to do with, how good, or this treatment is for you. It's, will you accept this based on your faith?
Hmm.
So I mean, it definitely does play a role in how we practice.
Isn't that uh, a strain put on you that you can't be yourself in the job you want to do?
It is, but I've accepted that I need to be the caregiver that each individual patient needs. So it's not about me, it's about them. And I kind of put my personal life aside, in order to provide them the care that they're expecting. And if that means that they want to pray, I'm not going to actively participate, but I will sit with them and do so.
Hmm. Yeah. Well, I think uh, that's compassion. I think should I be asked, I would do pretty much the same.
Mm-hmm.
But the fact that people still would demonize you if they knew, to me, that's completely alien. And um, to me, that would be a strain. But
And it is, and it's a little, I bite my tongue quite a bit, especially, and it's not even so much with the patients as it is with my coworkers, um, because there's that certain culture that exists.
mhm,
But the outlet that I get from the Twitter community is that it's like-minded people, and I don't have as much of that in my quote unquote real life. So it's, it's helpful to interact with people that actually understand.
yeah. But what would you say are the things of the main concerns you bump into when it comes to healthcare and maybe religion interfering?
I mean, on a patient by patient level, we run into all kinds of things from, you know, uh, patients refusing a C-section, even when it's the medically indicated best way to go, um, because of their religion. And I've had, um, obviously not giving any specifics, but I've had family members be with a woman who is in danger, and her child is in danger, and tell us that we are not allowed to do surgery on her based on their religion. Um, and that's had to go up into the legal system in order to resolve. Um, Things like blood transfusions are, sometimes that's a major discussion, for people to understand exactly how that, what the risks are. Um, yeah, and it makes me sad on a personal level that, we can't sometimes provide the care that we know is best, but I have to also respect their wishes.
Hmm. But isn't that extremely frustrating when you see that you have to step away from a medical procedure uh, that could be a lot safer, maybe?
Yes. Yes. And you know what? A lot of it, religion related or not, there are a lot of choices that patients make that we can only suggest, we can only guide, we can't impose things on people, but nor would I want anything imposed on me. Um, that's just sort of a belief on my part. I don't think anybody should have anything imposed on them that they're not comfortable with.
No, but that's not what I mean, because do you really think that these people who refuse, as you just said, maybe a C-section,
Mhm.
do you think they think it through?
Well, that's my job. Is
What the dangers would be?
Yeah, and that's my job, and the job of the other medical professionals around is to ensure that they understand the ramifications of that decision. But once we've explained, and we've ensured that they can verbalize back to us, like, yes, I understand. Um, Once we've made our case, short of and again, in certain cases, it has gone up the ladder to legal. If we do think that there's a decision that's affecting, like, for example, a baby that needs to be, an intervention. But that's awfully rare. Um, every day in every hospital across the country, we can only just explain and then, encourage them to make the right choice. But yeah, it's incredibly frustrating.
Yeah, and I also think a lot of the healthcare that you have in the U.S. is restricted, and I think that religion might have a part in that as well. Um, because the ones that I watch closely are the young Earth creationists, and they seem to have the idea that well, healthcare is something you should vote against because I'm not paying for someone else's healthcare, which I then think, if you're following Jesus, at least the parts that you picked out uh, from Jesus,
Hmm.
you should act in the opposite way. And what I don't get is that the more religious the people are, uh, the more they're against a universal health care.
Yes. And it does. It's the conservative platform that it's sort of a to everybody's on their own approach, which I don't quite understand either, to be honest. And I think what most people don't understand is that, I mean, we're already indirectly covering a huge amount of care. Um, you're already paying for it in one way, shape, or form. When we have to, I mean, because when somebody arrives at hospital in an acute health situation, they're not going to be turned away.
Hmm.
Um, and so that care is gonna get covered. And yes, hospitals do have funds for charity care in a lot of cases, but that it gets passed on up through the costs. And eventually it lands on the people who are, usually it lands on the middle class, but that's probably another discussion. Um, yeah, I don't understand that attitude either, that you're not responsible for the plight of your fellow man. Um, I can't imagine taking that approach that, yep, you're on your own. Your child that has this ongoing health condition, you're on your own. Um, and I'm not sure how they reconcile that with themselves.
I think a lot of them don't even think about it. Um as long as they can pray for someone, I think it's fine, I guess, because that seems to be uh, the magic solution
Mm.
when whenever there's something you can't handle. But what I don't get is that if you have universal healthcare, it also benefits you. So why would you be against it? And if it's if it's mandatory, the costs go down because everyone has it and everyone has to pitch in.
Yeah, and I
So
I think they do take the, because every system has flaws. I mean, let's face it, there's no perfect system. And they tend to, well, first of all, it's change and people are terrified of change. Um, and second of all, they tend to focus on these tiny little flaws and, maybe some medium-sized flaws, but it's they can't see the greater good. Um, I don't know if there's a perception that it's somehow taking away choice and freedom and all that crap that people like to spout off about. I honestly don't understand the other side of this issue. I mean, there are many issues that I can look at and say, yep, I can see where they're coming from. I don't agree with it. In this case, I honestly don't know how they justify the continued madness that is healthcare in the United States, healthcare costs in the United States.
yeah, and we discussed this in the intake briefly because I'm from Holland. I don't have a clue what happens in the US for the most part.
Mm-hmm.
What I get is what I get from my Twitter feed and from the people that I know on Twitter and that I talk with, and most of them are Americans.
Mm-hmm.
So I do pick up a little bit every now and again. But there was a decision made last night,
Uh,
uh, or not a decision made. Something expired. Can you
yeah, the chip
elaborate on that?
the chip program, which provides health care to children from families that are of lower socioeconomic status, expired. So there's currently several million children. I think, I don't quote me on this, but I believe it's 9 million children that are currently without health care because this program was allowed to lapse without being addressed by our lawmakers,
Hmm.
which is just infuriating.
Yes, because when it comes to children, I don't get it. That's not something you let expire
Or
because
adults for that matter. I mean, there are people who depend on this for their, their literally their lives. Um, and there's just no sense of urgency or, compassion.
yeah. Well, there are a couple of people in the chat right now. Um, One might be related to you. Uh, Matthew Holmes said, "Infringing on their personal choice is what they hate," and that's exactly what I don't get because um, infringing on your personal choice. If you have universal healthcare, what's to choose? Because you're covered.
Yeah, it's mostly a perception rather than a reality of having any. I Having the choice of a health of a insurance provider really does not do anything for us. I mean, I think I mentioned to you previously, Peter. I mean, I work for a very large health system
Hmm.
um, that actually has their own health plan. Um,
Yeah, you mentioned that. Yeah.
and as an employee, my insurance sucks. It's terrible. Um, and I mean, so you can, have the best job in the world and have commercial insurance, and it's not necessarily anything great, and it's expensive. Um, so yeah, that perception of having choice is, great, but what is that actually doing for you? And I think it's just an education thing and a sheer stubbornness on the part of a certain faction of America that values their perceived freedom above all else.
Yeah. Yeah. Well, when it comes to education, that's a a whole other can of worms that I can get mad about, because I st- I still, to me, it's like looking to people who are still in the dark ages when it comes to education. When so,
Yes.
but um, yeah, what's going to happen if they repeal the ACA?
Um,
They're still trying.
yeah, they're still trying. They they have to come up with another plan. There have been two, I believe, that haven't been workable yet. Um, it's not perfect. The ACA is not perfect by any stretch of the imagination, but it's also given people who haven't had care the ability to get care, and that's huge. Um, it, access to even just preventative care. I mean, because if people don't get preventative care, all that happens is that they show up in the emergency department with acute, serious issues, and that costs significantly more than just keeping up with routine, maintenance. Um, and so that's, I mean, benefit of the ACA, people can go see their doctor about things before they get serious. Um, People can take the medication they're supposed to take.
Yeah. Are you still here?
Yeah, I'm here. Sorry.
Okay, because it could went completely quiet, and I
I
think
might
I
have.
think I think you're doing the same thing that I do when I do these live talks. Have to keep my hands busy because I can hear you fiddling around with stuff, or maybe gesturing.
Yeah,
Uh,
it's probably just true.
yeah, Karis does that a lot. I can't see it, but she does that a lot when we have live talks. And then after the live talks, we chat about how it went normally. So
And stop
and
gesturing.
and and she almost always says, "Why am I gesturing? There's no camera, no one can see it, but just me." But yeah,
Yeah, so ACA is a big. I mean, it's valuable, and frankly, it scares me that there's the prospect of losing it, just because there's nothing better right now. Um, and they haven't even come up with anything that's close to being comparable.
hmm but the one of the biggest problems, I think, would be single payer healthcare, with when it comes to what you have now, because that's still not an issue.
Having single payer,
Yes, having it. That's
wi-
not part of ACA, I think.
ACA basically, it's complex, but it right to buy health insurance um, at rates that they can afford. Here in the United States, we have most people get their insurance through their employer. Um,
hmm
and if your employer is not of a certain size, they're not required to provide health care for you. So, or, they're not required to provide health care that you can afford. So, ACA does many things, and it forces the insurance companies to cover certain things that they otherwise wouldn't. Um, Birth control being one of them. That's huge. And I'm gesturing again. Um, and
And now
um,
now now I mentioned it. Now it's going to get worse.
um, but yeah, I mean, it does a lot of things for a lot of people, and losing it at this point would be a tragedy.
Yeah, but to to Americans, it's I think everyone knows about it. For people in Europe, it's an alien thing. We have single payer healthcare.
Hmm.
Can you explain a little bit what what goes on in the US? How does it work? You have different companies covering
Oh,
different.
yes. So there are innumerable insurance companies, and each of those companies has a different set of plans that can be chosen, and they all cover different things. So for me, just as an example, uh, if I have a patient that would like to have a specific surgery, um, we're going to call to her insurance company and see what's covered. And then if they come back and say, yeah, we're not covering that, then we have to submit a medical appeal saying, yeah, she needs it. You need to pay for it. And then they will either approve or deny that. Same thing goes for medications. If I have innumerable pregnant patients that would like to take the only FDA approved drug for nausea, vomiting, and early pregnancy, and it's expensive, and a lot of the insurance companies won't cover it. So I spend a vast amount of time appealing to this individual insurance companies and providing supporting documentation as to why this poor woman needs to take this medication. Um, but back to your point, yeah, it's huge and complex, and they all cover different things at different levels, and it's a little bit maddening to keep up with. Especially from a healthcare provider perspective, as to we can't just, oh yeah, here's what we want to do, let's go do it. We have to, get approvals and make sure that things are going to be um, are paid for, so that our patients aren't getting stuck with huge bills.
Mhm. But is it that you have to have multiple insurances uh, uh, at different companies, or how does that work?
No, it's just a competitive market. So an employer will choose an insurance company based on their rates, and they'll say, all right, well, we're going with this insurance company. Here are the different plan options. This is what you can elect,
Mhm.
to get. So a lot of people don't necessarily have a choice. They have to go with what their employer chooses.
But you could end up getting a plan that doesn't cover something you might be suffering from.
Exactly. Exactly. And then
And
we have to figure out what the next best option is for that person.
how do you solve that if something isn't covered?
We
Is the only option to go to the insurance company and try to get it covered anyway,
Well,
or how does it?
then we look at our treatment plan and say, all right, well, we can't do this, but we can try this, and if this fails, they might pay for it. So you can see how ridiculous this is.
Yeah, that at least that sounds ridiculous.
It is. It is. They want us to prove that something doesn't work before they'll pay for the thing that will.
And in the meantime, uh, the health of the patient isn't even an issue.
Precisely.
That's
Yes.
that's something I won't get. I'll never get.
Me
Um,
either.
we don't have uh, the most perfect system here because there are a couple of treatments in the US that aren't covered by healthcare here. So that's where people go crowdfunding
Mm,
sometimes. But um, for the most part, I think pretty much everything is covered. I told you we have what they call uh, personal risk, which is a couple of €100 um, that you need to spend if you get any medical bills, whether it's treatment or medication.
mm,
So the first couple of €100 you pay yourself, and then the rest is covered by the insurance companies. So it, to me, it's still it's weird, but I also think that when it comes to the ACA, it was difficult enough to get that through. So
yes.
the fact that it's complicated, I think could be the reason. Uh, am I
No,
correct?
no, it's complicated. Billing is complicated. The bills are complicated. People don't understand them, and it was like that before ACA. It didn't fix anything. It just filled some of the cracks in the system, and it did it very well. And it allowed people who hadn't otherwise been able to get the things that they need, to have them. But it certainly didn't, change the system from the bottom up.
Hmm. Okay. Um, I wanted to move on to the next topic
Sure.
we discussed, and that's Planned Parenthood.
Mm,
I think not a week goes by that something comes up, at least in my Twitter feed, about Planned Parenthood, and it's mostly the Christians who want to attack it and who want to have it abolished and removed completely. Uh,
yeah.
I don't think that a lot of them know what Planned Parenthood does, because all I ever see about Planned Parenthood is about abortions, and that's uh, not everything they do, and I don't think, not even by a long shot. Am I correct?
Correct. It's a small portion of what they do, and the whole reason that the Christian faction wants to do away with Planned Parenthood is simply that they don't care what else they do. They simply want to go with a provider for those other things that doesn't support abortion. The problem with that is there isn't another provider that size and that scope that provides these things for people. And furthermore, you're talking about doing away with something that is currently legal and is one of our rights.
Hmm.
Um, Planned Parenthood provides a huge number of services for women. They do well woman care, which is what I do, but in sort of the private practice setting. And they give access to women to take care of themselves and to get routine exams and to get STD testing and for education and contraception, things that are vital parts of our health. And all of that gets minimized because they also help women who need it to get abortions. If you review their website, they're actually very fair. They don't highlight abortion, they don't push abortion. They have a huge amount of information for women to consider before they go down that road.
Yeah,
And they're very specific about, what to expect and what your other alternatives are and that kind of thing. So I think they get painted with a very negative brush in a lot of circumstances, but they're doing a huge amount of good for this country.
yeah, yeah. Well, we had earlier in the chat. It was mentioned by Flavio Balderdash. I
Hmm.
think uh, he's someone we both bumped into on Twitter before, and he mentioned contraception.
Hmm.
I think that would be a major issue, at least in a conservative, predominantly Christian country, because yeah, as I said, compared to us, you're still living in the dark ages, I think,
Yeah.
um, because they're going to go against everything in that field. And the funny thing is that where there are the most unwanted pregnancies, those are the more fundamentalist Christian parts of the country.
Hmm.
So I think that they would they would benefit from it. But yeah,
Yeah, and to
It,
them, there's only one answer, and that's abstinence only. And obviously, that doesn't work. And they don't want women to undergo abortions, but they also don't want them to use contraception. So it's you can't have it both ways. And
mhm.
I mean, I was actually just reading that the number of abortions under Obama was lower than any other recent administration, and they attribute that to ease of procuring contraception. So I don't understand how anyone's arguing against this. I mean, obviously, if they're saying, if their argument is life is sacred, then let's keep it from happening in the first place, and then it won't be an issue. Versus, you can't have contraception, and you also can't do anything about that unwanted pregnancy. And oh, by the way, we're also not going to provide health care for that child once it's born.
Yeah, it's it's cornering people in every way they can, I think.
It
And
is.
that, um, well, you know that I'm a fan of Aaron Ra, and I follow him a lot. And in one of his talks, he mentioned that Texas at this moment has the highest rate in teen pregnancies,
Mm-hmm.
as well as the highest rate in repeat teen pregnancies. And so that's devastating. Those are just lives ruined because, well, we all were young at some point and maybe did stuff we didn't think through. But that's impacting lives, I think.
It is, and it's not only their lives, everybody's lives. It's an economic issue. Um, it's and the cycle perpetuates. If those teens aren't given adequate, access to care, education, support, then yeah, they're going to get pregnant again, and their kids are going to undergo. It's just it's a vicious cycle of lack of access to education. I don't think they're ignorant by any stretch of the imagination. They're severely lacking in resources,
Mhm.
and it's preventable.
Yeah,
Uh, but I mean, even in my area where, yes, it's conservative, but no, we're certainly not, it's not that fundamentalist state of, in some parts of Texas. But I mean, I talk to young women all the time that have no idea what they can have, what their options are in terms of contraception or protection for that matter. Um, they don't understand that if they are on the depot shot, that they're still at risk for, STDs. And it's access to healthcare providers and, like the ones at Planned Parenthood that can help with that issue.
yeah. I was I was a little bit off because I'm looking at the chat right now. Um, I think they're talking more about you than about what we're discussing here because um, you seem to favor Target, TJ.
What?
Well, that's mentioned in the chat. Don't mention
Focus.
Tar, don't
Focus,
mention Tar,
people.
Tarjay to Molly. That's her heaven.
Seriously?
So I don't have a clue what that is because I'm Dutch. So you'll have to explain that to me
Don't just
after
don't go
we're
there, Peter. Just don't.
after we go off air because that's,
I have to go track some people down now.
yeah. Uh, well, I'm since I mentioned it, this was Matthew Holmes who let us know that.
Who is a dead man?
Who is a dead man? Okay, well, he knows now, I think. But he's back on target, which I think is a nice pun. He says sex education today is abysmal compared to when we were in school. So I don't know when he was in school, but
like 1900 or so, I'm sure.
1900?
um, to be honest, I didn't get a great education in terms of that. I don't feel like they did much into it was very strictly the biological perspective and really not much else in terms of practicality. Um, and I remember in high school kids with, just serious misinformation about contraception and sex and, pregnancy and disease. And it's pretty much the same now. I mean, I'm sure the education in various parts of the country is different in quality and scope, but yeah, I mean, certainly in those religious conservative areas, it's going to be worse. And they're
Yeah.
going to go looking for information wherever they can get it, and a lot of times it's wrong.
Yeah. And but what other places are there to get information? I mean,
Reliably, healthcare providers.
yes,
I mean, the schools can't really. I don't think that they've come up with a good, universal plan for teaching this in schools, unfortunately. So yeah, I mean, healthcare providers reliably around the country are going to give the best information.
but are kids going there?
That's the problem. Yeah, that's why Planned Parenthood is valuable, because they can, it's there's a lot of them. They're easily accessible, and yeah, we try to get as many kids in for routine care as possible, and to do as much education as we can with them. It's not perfect.
And in what way can they get education at Planned Parenthood?
Well, that's one of the services
Was
they
it?
provide is when they come in for anything, um, they're going to help them out with understanding. The it goes along with that well woman care, that routine care that they should be getting. A lot of our time spent in the office is not with exams, is with education for people. And
Mm.
Planned Parenthood is no different.
And so you do that as well?
Educate, yeah. I mean,
Yeah.
yeah, I do actually a lot of patient education. It's actually my primary role at the moment. Um, and just to sit with them and kind of gauge their understanding, and then you know give them resources and knowledge. It just increases their rate, their odds of taking care of themselves better.
Mm. But how does that work? Do you get to spend time with those people? Do you
Yeah,
is it actively teaching, or is it giving out booklets or pamphlets, or how does it work?
it varies per the patient. You learn fairly quickly as a nurse to gauge people and what their best method of teaching is. If I have a 14-year-old in front of me, I'm not going to give her a bunch of literature because she's not going to read it.
Hmm.
um, I'm probably going to sit and discuss like what her concerns are, what she's got going on in her life, and try to address those specific things with her. And with teenagers, the huge thing is to not come off as judgmental, because they're already facing that from a lot of different arenas, and we want them to trust us and to be open with us about what their lifestyle is, what their concerns are, so that we can help them. I'm not there to give them lectures. I'm not there to make them feel bad about their behavior. I just want them to be safe.
Hmm. Yeah, well, but I think that's another issue, because the talks we've had leading up to this, at least I got the idea that you're uh, pretty engaged in what you do, and because I saw you get mad a couple of times on Twitter uh, when a tweet passed by. So, but if it comes down to that, is it enough that people like you give the education, and would it be different if let's say you had a coworker who had a more fundamentalist Christian background? Would that coworker give the exact same information, or
You would like,
is that something that is bound by rules by your employer?
uh, not so much. So we're, as healthcare providers, expected to be compassionate, to, and sensitive to the needs of our patients. I In general, I would say that we as a profession refrain from inflicting our views on our patients. Is that across the board to the same level? Absolutely not. But it should be, because as we touched on earlier, it's not our job to impose our beliefs on them. And if they're coming to us for help, it's our responsibility to make sure that they're getting what they need versus what we believe that they should or should not be doing.
Hmm. Okay, but I think that would be a lot easier decision when you're an atheist than when you have a belief that has some restrictions.
Yeah, and it's a consideration. And you know what? We have there's a Catholic university here that frustrates me because they refuse to help their female students out with birth control. Goes against their beliefs. And that puts a whole population at risk, because there's a lot of these girls that can't necessarily make it that far off campus. They don't have a local doctor, and they end up, not getting the same kind of care that they would in their home state if they're here from out of town. Um, and I've told them, I'm like, just, if they're getting, for example, the problematic one is the birth control injection, because it's not something that they can just get at the pharmacy and give to themselves. And I've told them, just come here. I know you're not a patient. We'll do that for you because your school won't. It's frustrating, that these beliefs dictate the care of their students. And I can imagine, as a healthcare provider with those strong beliefs, that it might be a struggle. But we also have a duty to people to make sure that they have the best information.
Hmm. And but so they can come over to you and get birth control, and that's paid for, or how does that work?
Well, we're still going to take their insurance information, obviously, but I mean, I'm not going to make them, you know, establish care with the practice and that kind of thing. I'm going to ensure that they're cared for, but I'm also not going to hassle them and, make it a big ordeal for them either. I just want them to be, protected.
Hmm. Yeah. Um, well, I did search a little on, particularly on Planned Parenthood, because that's what I bump into the most,
Hmm.
and the fact that I now have someone uh, working in pretty much the field that has to deal with some of the problems that would arise. Um, I pulled up an article. I think I can leave it in the description later. Um, but there are a lot of things uh, that are at risk when I look at this. And one of the things that stood out to me was higher rates of child abuse and murder if Planned Parenthood is defunded. And that to me was hair raising.
Yeah. Um, Certainly with unplanned pregnancies, that you take away the opportunity for people to explore things like abortion or adoption, which, by the way, Planned Parenthood also addresses, is adoption.
Hmm.
Um, you're going to have children born into less than ideal circumstances. And some people, they deal with adversity and they step up and they become fabulous parents. And some people aren't cut out for it. And when you have children that are in these situations, it doesn't always have the best outcome, to put it mildly. And yeah, that's part of the fallout of taking away the options for people to figure out what's best for their lives in these circumstances.
Well, I think it's when you look at it, it's maybe something that's quite natural, because if the child is not wanted, uh, if the mother is young and the father just walks away, which is, I think, most of the time what will happen, um, it's going to restrict your life. And if there's if there's no care at all, and if there's no way to turn to, I think some of them might get desperate that way. But to me, it's still it's a horrible thought that in a Western civilization, people aren't thinking about that group, because that's I think a pretty large group.
Well, yeah, and they're so busy, talking about the sanctity of life that they're not considering the life that's already here, it's being affected and suffering. So, and keep in mind too that there are a lot of these girls that have issues of their own before they even, become a mom, and that doesn't go
Mhm.
away instantly, and certainly not if they're not getting support. So, you're having children that aren't even necessarily with their parents. They could be getting left, you know, in any kind of caregiver circumstance, and it's just a recipe for disaster and the kind of things that you're talking about that I can't even really verbalize because it makes me upset.
Yeah, it it's something that's striking home with you.
Yeah.
Yeah, yeah, I could hear it in your voice, doing talks like this. Sometimes you pick up something. So um, we'll go to another other topic. Uh, Not sure if it's going to be a lot better,
Well, that's okay.
but what I also found is that more women will die of preventable causes,
Yes,
which,
absolutely.
because uh, yeah, as we talked about, they do a lot of other things than
Hmm.
just performing abortions. And uh, the reason that I want to point this out is because I get a lot of Christians that I talk to on Twitter. So at least having this out, maybe I can point them to this and try to have them look at it in a different light, because it's not that black and white as they make it out to be. Because if women die of preventable causes, Planned Parenthood does screenings, and what I what's pointed out here is for breast and cervical cancer.
Hmm.
Um, that's, I think, a part of healthcare that you don't want to lose.
No, that's a large part of what we do. It's just routine screening for this kind of thing, and there's so for the non-healthcare people, um, the higher risk for cervical cancer comes along with a virus called human papillomavirus or HPV. And you may have heard about it because there's vaccines available for certain strains, but there's a whole bunch of different strains of this virus, and it's in the strictest sense it's sexually transmitted, but it's in a huge portion of the population, and certain strains put you at higher risk for cervical cancer. So one of the things that we do for an annual exam is to do a pelvic, do a pap smear, and to check for this virus just to see if people are at risk. Um, Without that routine screening, people come in several years later and they've got full blown cervical cancer. It's so easily preventable. If we catch it early, we can take care of it in a huge percentage of the population. It's one of those
Yeah.
things that it's so easy to screen for, and it's so easy to treat once we catch it. But once it's too late, it becomes much more difficult. And that's one of the things that Planned Parenthood is doing, is just doing those routine screenings. Um, Breast cancer, huge thing. We try to routinely screen for it. Again, if we catch it early, we can definitely do something about it. But these are all services that women need, and that they may not have access to without a Planned Parenthood. Um, there's, I don't know that people understand the role of women's health, in that it's huge. People actually will use us like their primary care doctor, um, in some cases, because their well woman care is the only care that they're getting from a healthcare provider. And so it's important that we make sure that we're giving them access to that.
Yeah, well, I recently had someone that I know on Twitter who told me about an HPV infection. I'd never heard of it.
Mhm.
Um, so it could as well be as common here, but to me it was completely new.
Yeah, it's
But it,
um it's it's becoming more researched, and its role is better understood at this point.
yeah, what I got from it, it's you can have it and it can lay dormant for quite a while, and then
Yeah.
become active, and it can lay dormant for several years. Is
Yeah.
there a way to find it if someone is infected and it's dormant?
Yeah, we send off the lab testing, and it'll come back and tell, even if the pap smear, like the collection of cervical cells that we send to the lab, even if that comes back normal, we can still detect the presence of that virus in the system.
Okay, so that is checked as well
Yes.
if people have the opportunity to come in, that
Yes.
is.
Yes, exactly.
And is that um, nationwide as good as where you are, or
Um,
how does that work in the US?
I mean, I know that there are areas that are really hurting for healthcare providers in general. This is certainly something that a family doctor could do if there are people living in an area where there isn't a gynecologist. Um, it's not something that is restricted to our field, but that, yeah, there are areas that are virtually healthcare deserts in the country, where people don't have access you know, to a healthcare provider close to them. Um, and that's kind of part of Planned Parenthood, is there's so many of them, and they're so prolific, that it helps cover those gaps. But yeah, I mean, certainly there's areas of the country where people don't have access as much as they do here.
Well, yeah, I can see at least the bigger distances that you have. Uh, Here we live on top of each other pretty
Mm.
much. Um, so yeah, that could be an issue. But um, what do you think needs to happen to get a change of mind, maybe to get people to notice that there are better options?
In terms of
Because in
healthcare,
yes,
I mean, I think a lot of us are well aware. I mean, everybody's kind of aware that something needs to change. Um, but coming up with a solution is, I don't know, it's so politically charged that it's not something that we can just trash overnight and start from the bottom up. Um, and everybody's agenda is conflicting, and it sort of loses sight of what's important. I would love to see single payer here. I think it would be beneficial. You know, again, it's not perfect, but it's such an improvement on what we're currently doing. I mean, all it comes down to is that, yes, I do think healthcare is a right. And I do think that everybody should have access to care and not have to worry that, treating their illness is going to bankrupt them and their family. And it's hard as a healthcare provider to know that this is going on and to be fairly handcuffed in our ability to do anything about it.
Yeah, what it would need is a change of mindset, and you should think that in the time we live in, where everybody has pretty much everybody has access to the internet and can uh, look around what's going on in different countries, um, and to see that there are better options. What do you think?
Yes.
What do you think? You said it's politically charged.
Yes.
What do you think is at the root of the problem with those who are against it?
Well, keep in mind, we do have a fairly large corporate lobby culture here. And like, it's a hugely complex issue, but there is the potential for corporate medical America to lose out. And money talks.
Mm-hmm.
So it's not healthcare providers on the level of patient care that are making decisions about this. It's people looking at the bottom line. And it's not people that are looking at the bottom line that benefits the public. It's people that are looking at the bottom line that benefits private industry. And I don't have a lot of expertise in terms of detail, but I do think it has a lot to do with greater political agendas than it does with actually providing care. It's, I would love to be idealistic and say, yes, that's the most important thing. Obviously, we should do that. Yeah, of course. But again, they're not consulting the people who are looking these people in the face and telling them, like, I'm sorry, you have cervical cancer because we weren't able to screen you for the past 7 years.
Yeah. Yeah, to me, that sounds something that I would never want to do. So that must be really tough. I'm just going to throw in another thing from the chat. Flavio just mentioned. He says, I think providing education on the available healthcare options earlier and more often to young people and old people alike wouldn't be a bad jumping off point. So we're back to education, which as I said, which makes me mad at some point when I bump into people on Twitter. Do you think that people could find a way at least to improve that?
Yeah, I mean, I really think that healthcare and education should go together. Make it a point in the schools to, I mean, when kids go to kindergarten in this country, they're required to have a dental exam, that kind of thing. I mean, who knows? Maybe it's a jumping off point to ensure that, when you're entering your senior year of high school, that they ensure that you have access to have a well visit as a teenager that includes that kind of thing, that includes some education on sexual health and contraception. But yeah, I do think it's valuable to start young and to make people, because then we get the 24-year-olds that come in that really have no idea how they, contracted chlamydia. Or, like, oh, I've only ever had sex once, then they're shocked that they're pregnant. Well,
Yeah.
not a surprise.
Yeah. Yeah, well, that's also a thing we discussed in leading up to this. sexual education, because I think that's something where religion has a big hand in preventing good education in that particular field. Um, are there other options, at least for parents, to go to? Because most of the parents wouldn't have had a decent education when it comes to that. And
uh, sorry, go ahead.
I told you, the people who are listening don't know this, but I told you in a chat we had before we were going to do this. When I watch American TV shows or movies, uh, I can see the difference in um, when teenagers are in the movies. The difference in how they treat things and how the boys treat the girls. And to me, uh, that's a huge difference from at least what I remember from my school days. So I think education would be key, and not only when it comes to healthcare, but to a lot of other things as well. Um, is it just me seeing that, or is that actually what's going on?
So here's the thing. Um, yes, a huge, and I'm aware that there are areas of this country that are less conservative. Um, so I'm just going to speak to this from my perspective in terms of what I've experienced and some things that I've kind of observed um, on a national level in terms of the news. But people are really uptight, um, and I think Americans have a very hard time, weirdly, talking about sex in an open fashion, and that extends to their relationships with their children.
Hmm.
And it becomes this stigmatized thing that kids are afraid to go to their parents and talk about it. They're afraid to ask questions. They're afraid to bring it up. And the parents aren't taking the initiative because they're, whatever their hangups are, they're not comfortable talking about it. And it's highly overdue that we as a society examine our values and decide, you know what, it's more important for us to be communicative and losing it, Peter, and safe, um, rather than to have these hangups that are, and I'm sure they're deeply ingrained. It's generational. If you didn't talk to your parents about sex, you're certainly not going to talk to your kids about it. But I think it's important because as a parent, you're the most important influence in your kid's life. I mean, we've heard it all before, like, oh, if you don't get it from the parents, you're going to get it from their friends. Well, it's true. And if I
as if
think
as if
if
as if the friends are specialists in
exactly,
that
and that's
area.
when you have things like, and I recall distinctly that there was this misinformation going around when I was in school that the yellow number 5 in Mountain Dew was equivalent to spermicide.
You'll have to explain this to me, because now you've lost me completely. This is and this is
Okay,
something I want to know, because
it's completely false, but so soda, okay, Mountain Dew,
yeah,
disgusting,
yeah,
but um, it has yellow number 5 in it as a colorant. And I
yes.
distinctly recall that when I was in school, there was this misconception that if you drank enough, that it would be equivalent to a contraceptive. This is the kind of crap that kids pass around.
I've never heard anything
Yeah,
like
well,
that.
that's fortunately
Mm,
because it's the dumbest thing I've ever heard. But
yeah.
um, but that's the kind of thing that's the kind of nonsense that gets passed between teenagers. And I don't know. I just am a firm believer that we all need to just shed some of these hang-ups about talking about this kind of thing, because it just makes it a bigger deal than it needs to be.
Yeah, but when it comes to schools, isn't there any sexual education in schools? Is that different in different areas,
It
or
is.
how?
It is. It varies greatly from area to area, school to school. And again, I think most of us, and if I'm wrong, someone please correct me, but I think most of us uh, had the experience of getting educated about the biology of, like, fertilization and ovulation, and the girls get talked to about their period, and that's really it. We don't get a lot on on sex. I mean, it's just it's the biology of of reproduction, but not sex. And that's frankly what they really want to know. Um,
Yeah,
and I mean, I've been out of school for a while. I'm 35, and I know maybe it's better now. I'm not sure, but given the interactions that I have with teenagers at work, I'm going to venture to guess that it's not.
no, I'm having the weirdest flashback. Uh, I'm 55, and I distinctly remember a biology teacher who looked like an elderly librarian, I think, in her appearance, and she had the most fun telling us about uh, the fact that there are things that can make it more enjoyable, and she liked to point them out. And she, I think, had some kind of a mean streak, because she would always go to those who turned the most red, to have them in front of the blackboard and point out the different areas, and have them uh, tell what they specifically do. So yeah, that's something I'll never forget, because yeah, the way she looked and the way she acted was so completely different, and she even had fun in talking about it. So, and
I'm in the wrong country.
it's not, yeah, it's not a taboo here. um
It's like
and
drinking, Peter. It's like drinking, okay? Like, we make it a big deal here. It's a big deal. And then they just go off the deep end with it, as opposed to just having it be a normal accepted thing, and then it doesn't become this taboo, forbidden, draw for people.
well, Americans are weird to me, because uh you can't have women showing a breast on TV, yet you have the biggest porn industry in the world. When you look at the Bible Belt, which are the biggest consumers of porn, it's
Well, and why
if
is
the
that? Why is that? It's
because
because they're repressed and they don't know how to cope with normal human sexuality.
well,
So,
I wasn't going to say it out loud, but I'm going to. I I'm 55 years old, and as I said, church doesn't have a lot of influence. When I was young, we did have a more religious part of the country, which, funnily, is the South here as well,
go
which is predominantly Catholic. And
figure.
so we had the comedians, at least in Holland, had a running gag that if you wanted uh, to have fun with a girl, find a Catholic girl,
Yeah,
because
that's a joke here too,
everything
actually.
everything is forbidden at home. So the Catholic girl is the girl who will uh, most likely try what you what you want to try. So
Yeah,
And that's
yeah.
not and that's not because you were raised Catholic. There's no insinuation there, but it's an actual fact that we
No,
have
yeah,
here in
that's actually a joke here too. Although I will say that sadly, Catholicism is not the most repressive of the denominations. So,
no.
um, yeah, I mean, I do think that the more repressed people are, the less of a healthy outlook on sexuality they can have, and that's just detrimental, and it's sad. It's hard to have, you know, and that's why porn's a thing, because it's this underground seedy thing, and it shouldn't be. People,
Well, I'm not sure if that's going to help in any way, because I've watched some of it, and it's not something for me. It's not how it works in a relationship, I guess.
well,
But
no, and if
that
you think about it, but that's where a lot of teenagers are taking their cues.
yeah. Sorry, Flavio just had a comment. They got to learn about sex somewhere. Why not run Jeremy? Well, I don't know a lot of names. That's
Oh,
one. That's one I do know, and that's absolutely someone I do not want to learn my sex from. Uh,
I'm not even gonna. Nope. Mm-mm.
no, well,
Um,
Flavio, next comment. We're not going to go there. Uh,
no, no.
no, but um, and I think that's bringing us to another risk, because now that we have the internet, uh, you pretty much have access to everything you want, because maybe some of the parents will have a restriction on the computer, but um,
Yeah,
I'm pretty sure
that's not gonna
I'm,
stop them.
I'm pretty sure most of the kids have ways to get around that. So
Yeah.
um, yeah,
Ah, Peter,
I
see, you're gonna get me into this whole uh dynamic between men and women on sex now, and that's just gonna be a whole other discussion.
what do you mean?
Well, porn is engineered, it's for men.
Yes.
Um, and so then that turns into a whole other sexual health issue, because then we're dealing with, misconceptions between the genders on, what's expected and normal and, healthy.
Well, when it comes to normal,
Oh, well,
when
okay, and I use normal in quotes. I mean, that's going to
yeah.
be greatly variable, per person, obviously. Um, but yeah, I mean, I think we can agree that most porn is not reflective of reality.
No. Well, it made me think of the talk we had with Pastor Locke, and something that we uh, pitched him, and we want to get back to that at a later stage, is the fact that women are just seen as available toys,
Hmm.
and a lot of the churches are even enforcing that.
Yeah.
So um, that's where, at least where the porn is helping them in enforcing that it's
Yeah.
all about the guy, and there's no place for the woman in all of this.
Yeah, or the perception becomes that that kind of activity is somehow is somehow, the norm that should be enough for women, and it's not necessarily.
It's absolutely not, I think. I wouldn't
Um,
say not necessarily.
hey, you know
I w-
what? Everybody has their thing.
yeah, but call me old fashioned, but in a relationship, I think we all have to uh, enjoy it, and not one a little bit more than the other.
Oh,
Because
agreed.
if, yeah, would you disagree?
Obviously not.
No. And yeah, that goes for every relationship, because I'm not only talking about the normal, in quotes, normal relationships. uh, I think these days it's quite normal to have different relationships, same sex relationships, and a lot more next to that. So,
Yeah.
and that's also something that isn't talked about in schools. I didn't get that because I'm just ancient, and I think 40 years ago that wasn't the topic of the day here as well. But I think
Well,
that's where we need to improve uh, in our education, and make them aware that there are more options than just the man and the woman.
well, and of note, Planned Parenthood also provides care to, um, the LGBT community, including men, um, in terms of education and health services. And I think that's really important too, uh, because it's not necessarily a population that can just, walk into any healthcare provider and just no questions asked be seen. Although that should be the case, it's not necessarily going to be the case. Um, and so that's another role that they fulfill that's really crucial.
Hmm. Yeah, and that's what I wanted to touch is for gay kids. Where do they go to get their information? Is that only Planned Parenthood? Are there more options?
No, I
Because
mean, it's just as limited as everybody else, unfortunately, and probably even more so because, despite um, advances, there's still a fair amount of bigotry, which is shameful.
Mhm.
And certainly any healthcare provider worth their salt is going to treat people equitably. But I can't say that that's across the board as much as I would like to.
So, are people discriminated
I'm
on their
sure they
sexual?
are. I'm sure they are. To varying degrees. Sure, on paper, on an official line, perhaps not. But I honestly don't know what happens in some of the smaller private practices that aren't answering to a larger entity. I don't know what happens on the ground level when people are interacting with them in an exam room. I don't know.
No. Well, at least it's not a problem that you and I will be able to solve, not even by putting up a video. Uh, there's another thing that I wanted to talk to you about, um, which has nothing to do with the title uh, of the video. Uh, it's something you threw at me earlier in a DM on Twitter, and that's anti-vaxxers.
Oh, Peter. Yes.
Um, I think I want to go and find someone on Twitter who's willing to talk on here. And I want to ask you if you want to be present in that talk and see where we can get there, because uh, I think that could be another good topic to talk about.
That's a heated one. Yeah, I have very strong feelings on that particular issue. So, sure.
Okay, so we have a deal for another talk, at least.
You just wanted to get me to say that in public. Yes. All
You
right. Fine. I agreed in public. I'll do it.
okay. Yeah, well, you were the one who said, I'm not sure if this is going to go well. I think it went very well. We've
Well,
been to,
except for the
we
except for the peanut gallery, but
except for the what?
the, is that an Americanism? No, except for the obnoxious Target comments. But other than that,
Well, I'll have that explained to me when we get off
yeah,
air.
just yeah.
Okay. Uh, we've been talking about an hour and a half now. I think
Seriously?
it's a good time to wrap it up.
Yeah.
Or is there anything you wanted to touch on? The,
No, yeah, no, you know, I think this is it's a complex issue. It's a complex set of issues, and obviously nothing's gonna, there's no resolution in sight. But it's just, I just want to reiterate that it's really important to ensure that people are getting information from reputable sources and to seek information about their own health, because ignorance can be the difference between life and death in some cases. And I always hate to see it come to that. So that's my public service announcement.
yeah, which was pretty much the reason that I asked you to come on in the first place, because I think it's something that we could put out there.
Yeah.
I hope we can at least use this on Twitter when we come across certain people
Yes.
to maybe listen to this. And so there's one comment I have to make, because there's someone who's almost always here when I do a live chat, and that's Beach Price. So she's able to judge, and she says the last part has gone well. Uh, she just joined in; she was late, so um,
Thank you.
that should be a compliment to you. And we'll talk about what we're going to do next, because
Okay.
I do want to tackle uh, anti-vaxxers in some
Yes.
way. So it would be nice to have someone uh, who's at least in the field, who can help with
Sure.
the medical part, and
Mm-hmm.
someone who's, I think, it's a pet peeve.
Yes.
Am I
It just
correct?
no, it's a lot. Yeah, that's a lot.
Okay. So thanks for the people who were listening, and threw a couple of questions in the chat. Um, if you haven't subscribed yet, please subscribe, and see you all the next time. Molly, thanks for coming on, and thanks
Thank you.
for sharing all of your
Yeah.
information.
Thank you for having me.
Okay, so bye everyone.